Alright, so we're gonna start off. This is gonna be my med room. Where we have Pyxis, and we're looking. First thing we're gonna look at the medical orders. This is the first time for me seeing the medications. Um, I'm looking at my medical order. I can also look at my MAR, and then so we are looking at both the systems, and we're looking at the patient's information. We can tell that his name is Mr. Ripley Clarence. We are comparing his name, his date of birth. His date of birth is 12/18/1943. As we can see in the medical order and in the MAR, same date, same patient. So yeah, we can also, when comparing these two, we can also look at other things such as his height and weight. We can also look at his allergies. We can see that his only allergy is for penicillin, and he gets a rash from it. So next, we're gonna move on and look at the medications. We have two types of medications. In this case, we have the scheduled medications and we have the PRN medication. His first medication is ofloxacin. As we can tell, it's a 0.3% dose. It's 10 drops each ear by ED twice a day. We go over here into the MAR, from the medical order to the MAR, and we compare that, and then we see that ofloxacin 3%, ear drops, 10 drops in both ears twice a day, therefore ear infection. So yeah, as we can tell, same medication, same dose, same route, and yeah, we'll move on to the next one, which is Flonase. Flonase is a nasal spray. He's gonna take 50 mcgs, one spray, and it's twice a day. So we go over here into the MAR once again. Flonase, 50 mcgs, one spray, one dose each. Yeah, twice a day for allergy relief. Next medication we're looking at, it will be Saletan. So for Saletan, it's 50 mcgs, one dose, one drop on the left eye each night. And so yeah, we're going to go over here and look at Saletan. It's 50 mcgs, one drop in left eye each night, and it's for the patient's glaucoma. Next, we would look at Dulcolax, which is the last medicine. It's a suppository. It's 10 milligrams suppository per rectum, 1 to night. We'd go over here and compare it. Yeah, it's right here. One dose, Dulcolax, 10 milligrams suppository, 1 to night. After looking at all the scheduled medications, we would go on and look at the PRN medications, which are medications that the patient has in case he wants them or as needed. We would look at over here at a medical order, and we have that he has Tylenol, and looking at the dose, the medication, the time, and over here, same thing, Tylenol, PRN, same medication, same dose. It tells you the pain level, so whenever the patient has a certain pain level, it tells you the scale. When comparing these two, we can also see, or we can also check for the patient, for the medication, the expiration. And as we can tell, ofloxacin expiration is 12/25/2025 expiration. So it seems like all the medications that the patient has is the same expiration. It's 12/25/2025. So yeah, that's good. Next, we would, so that would be my first check for the medication. And we checked the right patient, right medication, right dose, right time, and we will eventually do the right documentation. When we're here, we would then take the time and look up the drugs, because it's very important for us to know what we're given. And so I would go on and then I would look into my handbook for drugs or any other reliable source, and then I would look up a medication. I would look up what the medicine's for, what the side effects are, and some possible complications as well. Um, After looking at the medication, I know everything that I should know by now, and one of the things that I found out is that to give ofloxacin, I should look at the patient's labs. So in there, I'll be looking for some renal issues. So yeah, then we would move on into the patient's room, and we would go do. So we'd come over here. This is gonna be patient's room. This is gonna be Mr. Ripley. I have my MAR over here. I have a medical order. So we'd come in, and then we would knock. Hi there. I would same introduction. Same as always. I would come in. I would perform high hygiene over here with my hand sanitizer. I would introduce myself. Hi, Mr. Ripley. My name is Juan, and Juan Milan, and I'll be your nurse today. I'm gonna be giving you some medications. So yeah. After introduction, I would see if he's comfortable. I can tell that he has his call right there. He looks. I could ask him if he's comfortable. If not, we can make that happen for him. We could give him some privacy if he wants to, and if yeah, then we would move on and ask for 2 identifiers. The first one. So, could you tell me your name and date of birth, please? So he says, Mr. Ripley, clearance 12/18/1943. So I would check with medical order on my MAR. I could sell it to him. So same thing. I'm looking at my medications. I'm looking at my doses, and I'm checking my 6 right once again. Everything seems right, and yeah, because we want to give provide safety to the patients, and we want to give the right drug to the right patient, the right dose, and at the right time, and everything must be right. Next, we would I would ask, hey, Mr. Ripley, so do you have any sort of allergies? And then he would tell me, penicillin, and I could see in his chart, and then he does get one of his allergies is penicillin. He gets a rash from it. So we would do some teaching if that was okay with you, Mr. Ripley. He said yes. Okay. So we would start with Salatin. So Salatin, Mr. Ripley, this drug is going to be for your glaucoma, which you have in your left eye. Glaucoma is the prostaglandin, so that's the drug's classification. Some side effects that you could experience, Mr. Ripley, is some irritation. Your eyes could be darker, and you could experience some eyelash growth. So this medication is given for your glaucoma, as I said, and it's also for intraocular hypertension. Okay, so after explaining medication, I would perform an eye assessment with him. So I would grab my flashlight, and then I would check his pupils, look at his eye reactions, his pupil reactions. I would then move on and ask some questions. So, Mr. Ripley, have you had any difficulty seeing? Any vision problems lately? Any vision problems in the daytime versus the nighttime because of light? No? Oh, okay, wonderful. I would ask, are you currently taking any meds? And if so, what are those meds? And are you taking anything for your eyes specifically? He said no. Okay. Yeah. So and if he was taking any meds, I would ask him, what are you taking? And has it made it any worse? Has it made it any better? Any improvement? So we would inspect the eye. As we could tell, we would look for any redness, any crust, any drainage by the doctor. Yeah, we could also, look around and see if he has any pain around the eye, any sort of tenderness. So yeah, then we would move on, Mr. Ripley, into ofloxacin. this next medication is for your ear infection that you have today. And have you taken this medication before? And if same questions. And if so, has it made it better? Has it made it worse? Any changes? Next, I would ask you. I would do some more teaching about this medication. So the medication is given for the bacterial infection. It's classified. It's an antibiotic. Have you had any breathing issues? He said no. Okay. So because some side effects for this medication specifically, you could experience some breathing issues. So it's important to know if the patient has breathing issues. You could also experience some rash, diarrhea, fatigue, and depression. So if you experience any of this, Mr. Ripley, please let me know. We would then move on and we would inspect the ear. We could pull his ear back and then look at the eardrum. We would notice for any redness, any drainage, any tenderness, any pain, and if so, I could ask him how long have this been going on or anything like that. I could ask for his questions about his balance, because ear pain and stuff like that is related to your balance. I would ask him if any dizziness, and if so, I could perform a test and test it out, test his balance. I would ask him, for example, to stand up, spread his arms apart, and close his eyes if he's able to do it without, and then we would check his balance. So yeah, Mr. Ripley, let's move on into Flonase. Flonase, this medication is something that you already take at home, as I can tell from your chart. You say yes, okay. So this medication is for your allergies. It's a cortisone steroid, and this will help you to decrease the inflammation in the sinus, which is what you have. Some side effects again could be some breathing issues. You could experience some angioedema. You could experience some swelling in the throat. So please let me know. Once again, if you experience any of these, just let me know. For this, we would perform a sinus nasal assessment. I would bring my light. I would check and look at his nose. I would look for any sort of abnormalities, any bumps sticking out. Yeah, I would look for any redness, drainage, any like bleeding or anything like that. I would then put on some gloves, and then I would do some palpitation around the nose. I would just check around, press lightly, gently, and then I'll ask him, do you have any pain when I do this? Is it itchy, unusual itchiness, or anything like that? And then he said no, so that's great. I would ask him, have you had this Flonase medication before? And if so, has it helped? Has it not? Has it gotten worse? So yeah, last but not least, let's go over the last medication, Mr. Ripley. It's going to be your Dulcolax. So this is the drug that you actually requested, Mr. Ripley, and this is a suppository. It's a 10 milligram suppository, and it's for your constipation. Some side effects that you could experience with this could be some abdominal cramping. So since it's classified as a laxative, so the purpose for me to give you this suppository is so you can have a bowel movement. Great. Let's go move on, and we would perform a abdominal assessment on you, Mr. Ripley. So I would get the patient comfortable, laying down. So in this case, I'm just gonna put him, 45 degrees. We would so first we would actually ask some questions about your frequency of your bowel movement. Can you tell me how often you have a bowel movement? And have you had any constipation issues other than right now? Any past constipation issues? No. Any pain in the abdomen? No. Okay. So we would just visually just look for any abnormalities, skin tone. We can absorb his breathing and any, just looking at his tone, his 4 quadrants in the stomach. Then we could we would move on into auscultation. So I would bring out my stethoscope, and I would listen to his 4 quadrants. I would start with the right upper quadrant, go across, and then go in a clock motion. So just around his 4 quadrants, and then I would take my time. It could be seconds or it could be up to a minute, and then I would just expect to hear some bowel sounds in there. Then I could go on into percussing. So for percussing, I would just grab my 2 fingers and percuss, and I would do it 3 times in each quadrant. I would move on and then perform it in the other quadrant, and then that same motion as previously, in a clock motion wise, and yeah, I would listen to sounds, and then I would move on into palpitation. So I would have some gloves, clean gloves, and then I would just palpitate his stomach and then see if I could feel anything. I would do it one more time just I could feel any abnormalities, any bumps, any sort of tenderness or painfulness. And I would ask him, do you have any pain while I'm doing this? He said, no. Great. Any tenderness? No. Okay, so here comes the fun part. So I perform my 3rd check here, and then I would ask him once again, Mr. Ripley, so before I give you your medication, can you tell me your name and date of birth? Ripley Clarence, 12/18/1943. Great. I'm comparing it over here to the medical order. You can see that it's him. Yeah. So once again, I'm looking at all the medications. I'm looking at each medication, and each. So every time I give him the medication, actually, I'm going to be looking at the medication, and I'm going to be looking at the dose, and I'm going to be comparing one versus the other one. So, for example, I would start with the eye medication. So, Mr. Ripley, we would get comfortable. We would get Mr. Ripley comfortable, and so we would have him lay down. So, I would put some clean gloves on. I would wash my hands. I would come in. Everything would be sterile, and then I would look at the medication. So I'm looking at his medication, and let's start with. We would do the. So we would apply his Salatin, 50 mcgs, 1 dose, 1 drop per eye. So Mr. Ripley, I'm just gonna put one drop in your eye. So I would do that, and then I would ask him if he could just grab his eyelid and just pull it down, his sclera down, and then so he would do that. I would do that, and then I would also ask Mr. Ripley if he could hold on to his, just press gently on his duct so the medication does not go all there. And yeah, so I would do 1 drop on his left eye, and so I would ask Mr. Ripley to stay there for 30 seconds, and so yeah, I would then take out my gloves and everything, and then I would do hand hygiene. I would put on clean gloves, because then we're gonna go on and move on to the ear medication. So for this medication, same thing as previously. Compare my medications, compare my MAR, compare everything. See that I have the right patient, right medication, right dose, right time, and right route. We would go on into his ear medication. So so it would be the I would let me see, Flaxicin. So yeah, it's a Flaxicin. It's a Flaxicin, 10 drops each ear, twice a day. Get him in the comfortable position, and once he's all comfortable and everything, I would have a cotton ball ready with me, and I would grab and pull his ear back, and then I would put 10 drops, 1, 2, 3, 4, 5, 6, 7, 8, 10, and then I would have that the cotton ball, and then I would just put it here, and I would ask him if he could hold it, and then he would do that for a couple minutes, for 5 minutes, and he would try to stay in that position for 5 minutes. Then we would change ears and then perform the same procedure, and then we would turn over, same thing, pull the ear, 10 drops, grab another cotton ball, and then put it there, ask him if he can hold it for 5 to 10 minutes, and then the cotton ball should stay in his Mr. Ripley's ear for 15 to 20 minutes. And the next medication, so I would, obviously before doing that, I would dispose my dirty gloves after each medication, dispose and grab some, perform hand hygiene, grab some new gloves, and I would go into my MAR and then look at Flonase, which is his nasal spray. So this is the one he's been doing at home, so he's more familiar with it, but we can compare it once again: right medication, right patient, right dose, right time. Flonase nasal spray, 50 mcgs, one spray per in the nose, and twice a day. So yeah, I would look over here, and so I would just hand it to him. I would make sure he blows his nose before doing it, so we can clear his nose. There's nothing there, any boogers, anything like that. So he would grab it, and then since he knows how to do it, he would just spray and breathe it in, and then he would repeat it. And yeah, so for this one he would repeat it, and I would ask him to stay in that position for 5 minutes. So we're all done with that. Dispose my gloves, of course. Come back, put some new gloves, do hand hygiene first, put some new gloves on. And last medication, Mr. Ripley, we're almost done. It's gonna be your rectum medication, the one you asked for. This is gonna, we're look over here, Dulcolax 10 milligrams suppository, right medication, right patient, right dose, right time. So yeah, I would ask him, try to get him as comfortable as I could with this medication, So we would ask him, Mr. Ripley, we would get him, we would turn him to his left side, and then I would turn his leg in a bilateral position. He has small legs, so it doesn't, can't really perform it. But I would put him in a lateral position, and then we would have some sort of like glue with us, so we could just, some sort of gel. We would have already gloves on, and then we would, now that in this position, we would, look at his rectum, look for any abnormalities, any bleeding, any hemorrhoids, anything like that, any abnormal, and then I would gently press the suppository in, and it should dissolve, and it shouldn't take too long. And then after that, I'll ask him if he can stay in that position for quite a few minutes, and yeah, I would just get Mr. Ripley as comfortable as possible. And then after each medication, I would tell Mr. Ripley that I would eventually check with him and, check back with him and see how he's doing, if he's doing any better, or if he's seeing any side effects or anything like that. And yeah, so after this, I would ask Mr. Ripley, are you comfortable? He said yes. I would look for his safety, check the bed breaks, if I move them or anything like that. I would give him his call light, he has it. And yeah, if you have any questions, he said no. Great, I would perform my hand hygiene, and then I would move on and do some documentation. So I would document about my meds, his reaction, yeah, any sort of pain that he had, any abnormalities basically. And yeah, that would be everything.